There's a lot of discussion about healthcare, mental health, what's appropriate and how safe is it and who's ethical and so on. I'm a clinician and I'll give my views on it. My name's Poppy, welcome. I'm a psychotherapist, psychologist, coach. I've worked for 30 years globally and I work for you. I'm unaffiliated. 3 things strike me here that can be very useful for everyone, which is to have a look at how we respond as humans when we see someone else being vulnerable and courageous in speaking into their life experience. Vulnerability and courage, you can't separate the two. We have to be courageous and vulnerable at the same time. We can't predict the outcome on either. And what happens when we witness people who are talking is we get quite insecure in our own way. The judgment that we have of them. You shouldn't do that or should do that. It's an inspiration or it's a warning. Or we should stop it or we should support it. A. B. When there's any kind of loud noises about anything, in my mind we get to A. Look at the source. Who's saying it? Not what other people are saying, what the person is saying. And B. Decide very consciously, what would we like to do with the information? Would we like to send love to that person? Or do we come at that person from a place of fear? If we're not being loving with our energy or our words, then we're in fear. And what we do with fear is judgment. So what does it say about us, the way we respond to other people, essentially? The other thing is, as healthcare workers, what we do get to do always, in my opinion, bearing in mind I teach and educate as much as I take supervision and therapy and mentors of my own, is to ask, how can we improve our brilliant work long term as well? So for me, I would recommend always that if we're in healthcare in any capacity, we immersively train and learn about healthcare, what's happening in the field, and also our own personal and professional development. How can we grow and develop and so on? In any profession, we have people who are excellent and anything in between, down to fucking wow, please no, can that person be around people? And again, we all have our own decision making about what is appropriate. I just swore. Some people would find that highly inappropriate. I do life my way and I encourage other people to do theirs their way. However, there is a pulse check on what is safe practice. Therapy, supervision, mentoring. I would say if you're ever interviewing for a therapist or anything to do with your mental health, or if you are one, have all 3. And if it's a no, there may well be a list of, I'm having a break from therapy, or I'm not finding a supervisor yet, or etc. Is there a plan to? And if not, why not? Because in my mind, that's not safe practice. 30 years in, for me, I'm not healed fully, when none of us are. And I'm not so experienced that I can't learn from someone else. We get into ego territory as the point when we're not looking at our own health, and that puts the health and the gravity of the healing we can offer at risk when we're not actually walking our talk. The other thing is, and I'm very, very particular about who I refer to, who I train, who I work with, and so on, because I know how abusive this field can be. So I'm careful. Very. And I've known it really bad for my clients and for me. So I get to scrutinize who has the pleasure and the privilege of being around people who are vulnerable and want to get strong psychologically or in any way. 30 years I've been practicing, and I lost count of the trainings I've had, the amount of them, and globally. And there are 6 people. I know there are an enormous amount of good therapists and professionals, 6, though, in 3 decades, I refer to if I cannot see the client myself, or I'd like to work with the psychiatrist or whatever it is with my client. 6. And I get it that may be shocking. However, I mean it when I say I am careful for very good reason. There are other people that I would trust, however, I know they're at capacity. They can't take clients. So, I would recommend certain fields. It's always the relationship with the therapist that is the predictor of the healing, not necessarily the treatment approach. We know that from the research. However, it is something to think about. Here's a woman that's very experienced and also has been very unwell mentally and in lots of different ways, and it's a lifestyle health. However, we may want to consider it is, how do we judge vulnerability, courage, and people speaking out? Does it intimidate us and we get all activated? Or do we look at, what can I learn from that? And as clinicians, are we actually practicing ethically, yay or nay? And that's ironic coming from me in some ways, because I practice in a way that's for the client. It's client-centered care that's at the bedrock of my practice and my business, Academy for Self-Mastery. So whilst I have supervisors and so on, I don't have moderators governing bodies, because in healthcare, freedom of speech is not a thing. And I take my oaths very seriously indeed. Informed consent being the main one that unfortunately healthcare has cancelled, for want of a better term. So if you're a clinician, have a think. Do you have therapy? Do you have supervision? Do you have mentors? And if not, why not? And if you're a client, ask those questions. Do you have that to your clinicians? And equally, in my mind, we can all step back and say, how do I respond to people who are in the public eye being vulnerable and courageous? And what does it say about me, the way I respond and the way I feel about it? And maybe even, could you take more risks? Because again, what I know is the top regret of the dying, I wish I'd had the courage to live my life rather than the life I thought other people expected of me. So take what you want and leave what you don't from what I've said there. And if you like this, save, follow, share, and all the things. I offer lots of different things. So at the top here, you can find links in the bio. Thrive Boundaries Mastery is what a lot of people are loving at the moment, and it's pay what you feel it's worth, because really I'd like us to get healthy and understand what a boundary is, which most people don't. We're not taught it. And also I offer coaching live here for subscribers on Sundays at 7 p.m. UK. Sending lots of love.